Good morning, everyone. Sadly, yesterday we were notified of the death of a man in his 90s with COVID-19. The man had been receiving end-of-life care at the Calvary Hayden Aged Care Facility prior to being diagnosed with COVID-19. He had been extremely unwell prior to contracting COVID-19. This is the first death where COVID is a contributing factor in this current outbreak and brings the total number of COVID-related deaths in the ACT to 4 since the start of the pandemic. Our thoughts today are with the man's family and friends at this difficult time. He was well cared for by the Calvary Hayden Aged Care staff, and his family have asked us to pass on their thanks to the staff for their compassion at this difficult time. Overnight, we can report 19 new cases. 17 of these are linked and the remaining 2 are under investigation. 7 of today's cases were in quarantine during their entire infectious period. At least 8 spent part of their infectious period in the community. 4 cases remain under investigation. We have 8 people in Canberra hospitals and 3 in intensive care, all requiring ventilation. Testing was again very high yesterday with 3,866 tests conducted. On the vaccination front, the ACT's vaccination rollout is continuing at great pace, with around 55,000 first and second doses being administered across the ACT on a weekly basis. We now have 86.8% of the population aged 12 and above with a first dose and 59.3% fully vaccinated. So from here, we have around 50,000 first doses and 150,000 second doses to administer to meet the demand from Canberrans. So this is a priority for the government over the next 4 weeks. As it's Monday, we'll outline the priorities for the week ahead. Over the weekend and again this morning, the ACT Emergency Cabinet met with the Chief Health Officer to discuss the path out of lockdown for the Territory over the coming weeks. In recognition of the current public health risk and our increased levels of vaccination, the Chief Health Officer has recommended some further changes to lockdown measures to come into effect from 1 October. So from this Friday, at 12:01 a.m, 2 people will be able to visit another household at any one time. The outside of home time limit for recreation and other activities will be doubled from 2 hours to 4 hours. Gathering sizes, though, will remain at 5 people. All non-essential retail will be able to operate both click and collect and click and deliver services, with a maximum of 5 people allowed inside a business premise. Outdoor boot camps, personal training and coaching can recommence with no more than 2 people excluding staff. ACT nature parks will also reopen. During October, the ACT will hit 80% of the population over the age of 12 fully vaccinated. We anticipate we will reach this milestone ahead of the national average, but this does not mean that we will stop vaccinating our community. We will continue until everyone who wants to be vaccinated has the opportunity to do so. After that, we will focus our efforts on the vaccination booster program. This very strong level of vaccination coverage will allow us to start taking gradual steps forward once we reach 80% vaccination coverage of the population aged over 12. So these steps will see us transition from high to medium, then low, and finally baseline public health measures. So subject to the public health risk remaining relatively stable over the next 2 weeks, the lockdown will end at 11:59 p.m. on Thursday the 14th of October. This will trigger a transition to medium level public health measures. So from the 15th of October, 5 people will be able to visit another household at any one time, and 25 people will be able to gather outdoors. Licensed venues, cafes and restaurants will be able to operate seated service at a maximum capacity of 25 across a venue, or 1 per 4 square metres indoors if that amount is less than 25 people. Alternatively, venues can choose to operate al fresco outdoors with a maximum of 50 patrons at 1 per 4 square metres. Hairdressers, beauty and personal services can recommence with a maximum of 5 customers at any one time. All non-essential retail will continue to operate under click and collect or click and deliver services, but the maximum staffing capacity inside the business premise will go from 5 to 10 people. Gyms will reopen with strict COVID-safe requirements with a maximum of 25 people at 1 per 4 square metres. The 25-person cap at 1 per 4 square metres will also apply to weddings, outdoor play centres, places of worship, outdoor auctions and community centres and facilities. Accommodation providers such as hotels and motels, campgrounds, caravan parks and campsites can reopen, as can swimming pools for organised lessons with a maximum of 25 swimmers. As the national vaccination average climbs towards 80% in late October, the ACT will continue to gradually reduce the level of public health safety measures. So from the 29th of October, again subject to a public health risk assessment at the time, a number of businesses and activities will move towards more relaxed density and capacity limits. Licensed venues, cafes and restaurants will be able to cater for 25 people across the venue before any density limits apply. Beyond this 25-person base, it will be 1 per 4 square metres up to 100 people and 1 per 2 square metres outdoors up to 150 people. This will also apply to many of the businesses and activities that were able to recommence on October the 15th. Organised sport will be able to recommence under the same density and capacity limits, and swimming pools will reopen to the public. From the 29th of October, 10 people will be able to visit a household at any one time, and 30 people will be able to meet outdoors. Ticketed and seated events will be able to recommence with density and capacity limits depending on whether they are indoors or outdoors. All retail stores in the ACT will be permitted to open with 1 person per 4 square metres from October the 29th. Cinemas, galleries and museums will be able to reopen. Dance classes, choirs and bands will also be able to commence in person with a maximum of 20 people or 1 person per 4 square metres. As the ACT's vaccination rate continues above 90% of the eligible population, further changes will be considered, including further easing density limits, such as to 1 person per 2 square metres, and increased household and outdoor gathering sizes. The requirements for interstate and overseas travel will be considered as we move through these phases of the ACT's pathway forward. But it is important to note that the ability to travel interstate or overseas will be entirely subject to the border decisions of other state and territory governments, and when it comes to international travel, to the Commonwealth Government. Turning now to schools. As indicated 2 weeks ago when we outlined the early stages of what Term 4 would look like in our local schools, work has continued on the safe return to face-to-face learning for all students. As part of the ACT's pathway forward, A gradual return of students from P to 10 will commence from week 4 of the term. Students in preschool, kindergarten, year 1 and year 2 and year 6 will return to face-to-face teaching in ACT public preschools and primary schools on Monday, 25 October. Students in year 9 and 10 will also return. All children attending early childhood education and care will be able to return to centres from 25 October. From the following week, which is week 5 of the term, Monday 1 November, all remaining students will return to face-to-face learning in ACT public schools. Our plan for students in colleges remains unchanged from what was announced earlier, with Year 12 students having access to their school campus from the commencement of Term 4 as they prepare for their AST. Year 11 students returning to on-campus learning will take place in week 3. Deputy Chief Minister and Minister for Education Yvette Berry is here and will discuss this return in more detail shortly, including the COVID-safe requirements that will accompany the return of students to face-to-face learning. Now, the ability to move out of lockdown and through the phases of the National Plan will be a welcome relief to all Canberrans. This is possible because of our nation-leading vaccination levels. However, the experience around the world in countries with high vaccination levels shows that the virus will spread quickly through our community once the high public safety health measures are removed. The ACT's pathway forward has been informed by modelling on the impact that COVID-19 will have on cases in the Territory and hospitalisations in the Territory, and on the impact of exactly the same phenomenon occurring in surrounding New South Wales. We can expect, as the nation relaxes public health measures, that the ACT could be recording daily case numbers in the hundreds. However, the higher the level of community vaccination, the lower those case numbers will be, the lower the number of serious illnesses will be reported, the lower the number of hospitalisations and people requiring intensive care, and most importantly, the lower the number of deaths in our community. That is why this has to be a gradual approach. It will be a challenge, but the ACT's pathway forward announced today will ensure that we make a gradual and safer step towards a better Christmas and summer holidays for all Canberrans. So in summary, for those who've joined late, 19 new cases overnight, 17 of these linked. 7 of today's cases were in quarantine during their entire infectious period, and at least 8 spent part of their infectious period in the community. 8 people are hospitalised and 3 are in intensive care. And we have sadly recorded our first death of this part of the outbreak. And our thoughts and love go to the family and friends of this individual. All of the details of the pathway forward are available on the ACT Government COVID-19 website for those who want to recap on all of the information that I've just provided. Dr. Coleman will now provide an update on the cases overnight and the epidemiology, and then the Deputy Chief Minister, Minister for Education, Yvette Berry, will provide an update on the return to school and face-to-face learning for students. And following that, all 3 of us, plus the Minister for Health, Rachel Stephen-Smith, will be available to take questions. Thank you.
Hello everyone, and thank you, Chief Minister. Before I provide our case update today, I would also like to express my condolences to the family and friends of the man who passed away yesterday. And so on today's numbers, we have 19 new COVID-19 cases that have been notified since our last update. This brings us up to 769 cases. 513 have recovered. We are managing 255 active cases. And just to run through the key highlights again, of the 19 cases, 17 can be linked to known cases or ongoing clusters, with 2 still being investigated. And of the 17, 13 of these are household contacts. Of the 19, 7 were in quarantine during their whole infectious period. 8 spent time in the community for at least part of their infectious period, and 4 continue to remain under investigation. We have 8 people in our hospitals, with 3 in ICU, all requiring ventilation. 5 hospitalised patients are unvaccinated, 1 has had 1 dose, and 2 are fully vaccinated. The age range of our hospitalised patients are in their 30s to in their 90s. We have over 1,000 self-identified close contacts and over 470 active exposure locations. So to provide you with a quick update on the outbreak at the Calvary Hayden Aged Care Facility, there are now 14 cases in total. We have 3 staff, 10 residents and 1 household contact. We continue to work very, very closely with Calvary to assist in managing this outbreak, and Calvary are communicating directly with families and residents of the aged care facility and the separate independent living units to keep them up to date. I'd also like to provide a quick update on what is happening in our construction centre on the back of my announcements yesterday. Today we will be adding 2 additional construction sites to our exposure locations. The 2 sites are in Dixon, and they include the site at 21 to 23 Chalice Street and the site at 330 Northbourne Avenue. The cluster that I announced yesterday, linked to the construction site at 7 London Circuit in the city, is now at 12 cases, with 3 additional cases included in today's numbers. We continue to work closely with the management of all these sites to identify any potential exposures and limit transmission wherever possible. As I mentioned yesterday, we are going to continue to see cases when we have essential workers in the community, and it's why our strategies, such as the COVID safety plan, is really, really important. These plans will help to limit spread and therefore limit the impact on our community. So I've moved quite quickly to my shout out today, and it's to all of the people working in our testing clinics, across all of our testing clinics in the ACT. Testing is a really critical part of our response and will continue to be so for some time into the future, and the teams have worked long and hard and in all conditions, including rain. Recently, we did reach over 460,000 tests over the entire pandemic, and with over 180,000 of these done during this outbreak. This is an enormous effort, and I just continual thanks for your hard work and commitment as part of the COVID response. I'll now hand over to Minister Barry. Thank you.
Well, good afternoon, everyone. As you have heard from the Chief Minister and through the Chief Health Officer, we have been advised that all students can now return to school in term 4 as safely as possible. In working out the logistics of what this return to school will look like, I and the Education Directorate have been listening carefully to our school communities. A survey of public school parents and carers and teachers, and importantly students, had over 6,000 responses returned in just over a week. These conversations fed directly into how schools will operationalise the advice of the Chief Health Officer to ensure that everybody feels safe when they return to school. So just to confirm again those dates to return to school, because I know there's been a lot of information provided today. From Monday the 25th of October, which is week 4, preschool, kindergarten and years 1, 2, 6, 9 and 10 can return to on-campus learning. These year groups will be able to attend their usual out-of-school hours cares programs. Children will also be able to return to the early childhood education and care services from the 25th of October. From Monday the 1st of November, which is week 5, the remaining years can return to on-campus learning. This is years 3, 4, 5, 7 and 8. Students will be able to attend all of their schools out of school hours cares programs. And of course, as previously announced, the phased-in school return will start with years 11 and 12. This means from Tuesday the 5th of October, which is week 1, Year 12 students can start returning to on-campus learning. Year 11 students can also return to on-campus learning from Monday the 18th of October, which is week 3. Some Year 11 students can also attend school for essential assessments from week 1 if that assessment cannot wait until week 3. Schools are commencing with these and communicating these arrangements directly with students and families, so please make sure that you check your emails. Now, this applies to all schools in the ACT, our public schools, non-government schools and Catholic Education Office schools as well. So that's all schools that these dates apply to. This timing of this staged return to school is in line with the ACT's COVID-19 pathway forward. It's designed to align with vaccination rates and the easing of restrictions in other parts of our community. Through our consultations with students, parents, carers and staff, P&Cs, school principals, non-government schools, as well as the Australian Education Union, the Community and Public Sector Union and the United Workers Union, we have listened very carefully to the feedback from our community, and this is what we heard. Students, staff and families want to go back to school, but everybody wants it to be safe. They told us that a phased return should prioritise students in transition years as well as younger children. And of course, our school communities want to know how we will make our schools safe. And that's why we've been taking the Chief Health Officer's advice every step of the way. Health and safety measures will be put in place in schools to minimise the risk of COVID-19 transmission. And these include encouraging vaccination of all eligible students, staff and families, mandatory use of the Check-in Canberra app for all adults. That includes teachers, school staff and any visitors to the schools. Improved school ventilation through maximising fresh air intake, physical distancing measures for adults as much as possible, and mandatory mask wearing for staff across all schools and for students in years 11 and 12. Other measures that will be included is things like limiting the mingling of student classes and year groups, staggering breaks, increased use of outdoor spaces, the limitation of on-site visitors, environmental cleaning, and of course not allowing anybody who has symptoms to attend school. All of these measures are important to ensure the safest return for our school communities. Now, I know that this is a lot of information to take in, so remember, schools will be in touch with their communities to support them through the transition back to school, and there will of course be all of this information available on the Education Directorate's website. Now, just before I hand back over to the Chief Minister for questions, I have 3 quick thank yous that I would like to make. Firstly, thank you to the students and families as they continue to learn remotely and stay engaged with their school communities. Thank you for your patience, your resilience and your kindness to each other. Secondly, a big thank you to our education staff. Throughout lockdown and all of its uncertainty, our teachers and school staff have done an incredible job supporting students and making sure that they get the best possible learning outcomes, as well as making sure that their well-being is looked after too. And finally, thank you to all of the students, parents and carers and staff who have provided all of this wonderful feedback through the consultation process. This has been invaluable in shaping a return plan that balances the health and safety objectives with the learning and wellbeing needs of our students. I'm happy to take questions after the Chief Minister has finished with his. Thank you.
Thank you very much, Yvette. Happy to take questions.
Chief Minister, you've delivered the news that I think so many people have been waiting for. On the same day you've delivered the news I think you've been dreading having to deliver. How much did that death give you pause for thought in announcing this roadmap forward?
Well, look, the work on the roadmap was obviously being undertaken in advance of the news of the death, but it serves as a reminder to everyone that this, even in the circumstances of this individual, that COVID is real and it will take people from us at whatever stage of life. And so I want to use this opportunity to reinforce with people the importance of getting vaccinated. And between now and when the lockdown ends on 15 October, I would encourage everyone who has yet to get a first dose of the vaccine to do so, to check with GPs, with your local chemist or through the ACT government mass vaccination hubs and get a vaccination appointment. That will provide you and those close to you with protection.
You've spoken about the case numbers that we might see. Is this an acceptance that we might see more deaths as well?
Well, the higher our vaccination rate, all of the modelling and all of the evidence suggests the lower the number of transmissions in the community, the lower the number of daily cases, and that flows through into hospitalisations, into intensive care and into deaths. And when you look at the data nationally and internationally, your chances of being severely ill diminish significantly if you are fully vaccinated. One dose helps, but it doesn't provide the same level of protection as being fully vaccinated. And the international experience is that it becomes a pandemic of the unvaccinated. Now, our endeavour, as it has been throughout, is to get as many Canberrans vaccinated as quickly as possible. Now, people now have very clear dates and frameworks around when we will be making steps forward. So that should send a very clear signal around the time frame that people who remain unvaccinated have to get vaccinated. And as we take the step out of lockdown, those first 2 weeks are a gentle step, but that will see an increased level of risk. But really the more significant change occurs at the end of the month. And so people who get their first jab in the next 2 weeks would be fully vaccinated by the end of October. So I strongly, strongly encourage people to do so.
You've told Canberrans to prepare for case numbers in the ACT to be potentially in the hundreds. Even at 100 cases a day, 700 cases a week, roughly 10% end up in hospital. Are Canberra hospitals capable of coping with 70 cases in hospital a week, given the impact New South Wales will also have on the system?
Yes, so I think the expectation is that the more vaccinated the population is, the level of hospitalisation may decrease slightly as a percentage of the overall case numbers based on the protection that the vaccines provide. So that's why it is critical that more people, those remaining 50,000 who haven't had their first dose and the 150,000 who are yet to be fully vaccinated, get to that point by the middle to late October. That will be critical. Now, we are confident that that is going to occur based on our current first dose percentage rate and the forward bookings that we have in the system. But this is a very clear call to those who are not yet vaccinated to take the opportunity to get vaccinated over the next 5 weeks.
Chief Minister, the situation is case-wise has probably deteriorated in the ACT. You've got two clusters, one at an aged care centre, one at a construction site, and you've got 2 more construction sites, and yet you've set out this pathway. Is that our vaccination rate, or trajectory of our vaccination rate, the key, and are we more or less coming into line with New South Wales on easing out of restrictions?
Well, our vaccination rate is critical. Decisions, and you'll see within the framework, it is a cautious step out of lockdown at very low numbers in terms of increased activity for a very specific reason. So we do want to see, by the time the 29th of October rolls around and things open up more significantly, that we are not talking about 50,000 people without a first dose and 150,000 not fully vaccinated. I'd like to see both of those numbers as close to zero as possible by the 29th of October. Our process obviously involves looking at the same modelling and taking health advice as other jurisdictions, and is based on our vaccination rate, the vaccination rates of surrounding New South Wales, and then the national vaccination rate. And so you'll see, now no one can be absolutely precise as to which moment in a specific day certain thresholds will be crossed. So we've been cautious in our approach here, with a view to give those remaining people who we've got bookings in our system the opportunity to get vaccinated. And for the fifth time already, I repeat the call for those who are not yet vaccinated and haven't made a booking. It's time. It really is time to do that.
And how many cases can the ACT tolerate in our hospitals before you have to review that roadmap?
Well, look, the capacity within intensive care is not extraordinary, but it does allow us to have more cases than we currently have. So we've mostly been seeing intensive care numbers between 1 and 4 at a time. The treatments are improving, and the length of stay in intensive care has generally been 1 to 2 weeks, depending on whether a patient needs to be ventilated or not. We would anticipate, based on our initial capacity, without having to surge, that we can tolerate up to around 20 patients in intensive care. Now, we also have to factor in that possibly a quarter or more of them will be from New South Wales. So that gives some sense. We can surge beyond that, but not forever. And so we need the vaccines to play their part in reducing the number of people hospitalised. And of course, we must draw the distinction between people who would need care at home, so hospital in the home care, versus people who would need acute care, versus people who would need intensive care. And we have capacity. We have the Garran Surge Centre, so we have the capacity. But if case numbers got into the thousands a day, then that would be very problematic, which is why we are so focused on vaccination between now and 15 October and 15 to 29 October, and why we need to very carefully monitor the situation through the month of November as well. Now, I do note that New South Wales have adopted almost an identical approach. Obviously, been listening to health advice and looking at the modelling. So I think we ultimately categorise what's happened, that New South Wales have come a little bit more towards the ACT position than the other way round.
Chief Minister, the civil construction industry reopened on September 3rd because you said at the time it had demonstrated compliance with COVID safety requirements. Do the cluster there and 3 exposure sites suggest that's no longer the case, or is it just the Delta variant being so quickly spreadable?
I think it's more the latter than the former, but so we're looking at and trying to understand the nature of the transmission in this context. And whether the COVID safe protocols that have been put in place will in fact limit the spread in these specific cases. There's always going to be a risk of transmission in a wide variety of settings. The question is, are our protocols strong enough to stop that becoming a major outbreak? And we've seen examples in healthcare settings, in aged care settings, in school settings, in construction settings. We're going to see transmission and outbreaks. The question is, will the combination of the vaccination rate, the ongoing public health, social measures and test trace, isolate and quarantine work to stop 9 becoming 90, becoming 900. That's what we're trying to stop.
With those restrictions that are easing come Friday, will that see an end to the restriction on moving between different regions within the ACT? Will people be able to travel more broadly within the Territory's borders?
Sure, but look, that's been guidance rather than a formal public health order in terms of moving outside of your areas. Look, we're not encouraging a massive free-for-all. The whole point of a lockdown is to reduce the interaction between people. But clearly opening some of those parks and reserves, national parks and nature reserves, will see people go into those areas. But of course they're big open spaces, so we may need to manage the flow of people, particularly at venues like Tidbinbilla, for example, where there would be potential for quite a large number of people to want to converge. So the advice to Canberrans as we come into this long weekend and the end of the school holidays is that in taking advantage of the 4 hours and the wider range of spaces that you can go, just be conscious to keep away from other people. And if you are unvaccinated, then you are at the highest risk of any individuals in our society as we make the transition forward. So you can address that by getting vaccinated or staying away from other people.
When it comes to the broader reopening that you've given detail of today, I've already been inundated with questions from various businesses. There's going to be a million of these what-ifs. Will there be some sort of task force that will go out and give advice to businesses to make sure that they are in compliance? And is there any sort of rules of thumb when it comes to the number of people that people can have in businesses?
Yes, so they're outlined. So if people want to go onto the COVID-19 website under the lockdown link, you'll then see the roadmap. They will, following the details of the pathway that we've released today, there is of course a subsequent level of further detail that comes in the public health directions. We will provide advice principally through the peak industry and business bodies, but also make available on the COVID-19 website more specific advice for each industry sector. Now, the changes that come into effect on Friday are relatively modest and straightforward. The changes that will come into effect from 15 October are more significant, as are the 29 October changes. So we are still nearly 3 weeks from the 15 October change and 5 weeks from the 29 October change. So there'll be plenty of opportunity for Q&A with particular businesses who want specific issues answered. We'll have webinars and seminars and further detailed information that will be available for businesses ahead of their gradual reopening from the middle of October through to the end of October. So I appreciate there'll be a lot of questions today. Last week it was, where's the roadmap, where's the plan? The conversation will quickly move to the fine detail of the roadmap and the pathway forward. We understand that, and we will engage principally through the peak industry associations, because they can disseminate information to their members that cover thousands of businesses across the ACT, but information will also be available on the COVID-19 website. And we will, as we have throughout the pandemic, as we did last year as we stepped gradually out, our compliance teams will have an educative focus over the next 4 to 5 weeks, and the compliance teams will seek to engage with businesses so that they can successfully make the transition through each step of the pathway forward.
Are you confident in vaccine supply now at this point? Have those issues been resolved, and how much does that impact on these dates remaining where they are?
We are reasonably confident. There are a few outstanding issues that I alluded to over the weekend that, perhaps for reasons of it being a weekend, were still not resolved by 11:45 this morning, but we hope to have resolved over the next 24 to 48 hours. That's largely to enable us to put more vaccination opportunities into the system. So we're confident with all of the bookings we have and our supply to be able to meet all of those bookings, but to bring things forward to get more people access to Pfizer more quickly, We are just waiting on confirmation of actual shipments and having the vaccines in our possession. As soon as we've got confirmation of that, we can open up more booking opportunities for people, and that's what we want to do. Because as I said, I want to see the remaining 50,000 or so who don't have a first dose to get that first dose, and we need to double vax, get the second dose into about 150,000 Canberrans, and we want to have achieved all of that by the end of October. That would be a very good outcome for Canberra.
If things go according to plan and restrictions continue to ease gradually, how much will these freedoms, for lack of a better word, be tied to vaccination status here in the ACT?
So there's no link. The pathway forward does not require someone to be vaccinated or unvaccinated in terms of distinguishing between. That is a difference. We're not going through the administrative and enforcement nightmare that is going to be about 3 weeks in New South Wales, it would seem, from what they've announced this morning. I think might be a little bit longer if they hold through to 1 December on excluding people from certain activities. But we are confident that because our vaccination rates will be higher and higher more quickly, that we don't need to go down the path of having a discriminatory policy between vaccinated and unvaccinated people in terms of accessing services. But that does not mean that we won't have vaccine mandates in particular high-risk settings or occupations. So I think we need to distinguish between those who seek to access services as opposed to those who are working in a high-risk environment.
What does your modelling say now about when we would reach some sort of COVID normal?
That is difficult to say. That's why we need to take the time and observe what happens through the month of October and then have another look at the end of November. But our hope is that Christmas will look more normal for everyone.
Questions for the Chief Health Officer?
Yes. Oh, sorry, yes, one last one for me.
One more. I didn't hear any mention of masks in the roadmap.
Okay,
so I take it we're stuck with masks?
Masks will be a requirement indoors for an extended period, but outdoors will come off, and I believe that occurs from when lockdown ends. But I'll just make sure I've not got that wrong. The Chief Health Officer can absolutely clarify at that point. Oh, she had to go to AHPPC, sorry. So questions for the...
A question about an unrelated matter for you, Chief Minister.
Okay, unrelated questions, yes.
The ACT government has written several times to the federal government now about the issue of territory rights. It hasn't received a reply. Have you raised that matter personally with the Prime Minister, and will you?
Look, I haven't raised it personally with him in the last 8 weeks during the lockdown and just before, but I will, and this will be an issue at the forthcoming federal election.
Questions for the Health Minister?
Questions for the Health Minister.
Afternoon.
The Disability Royal Commission has released an interim report which has been quite scathing of the federal government's rollout of vaccinations for the disability care sector. I'm interested in your response to that. Could the federal government have done a far better job?
Absolutely. I've said that many times. We've been extremely disappointed in the rollout for across the disability sector. People with disability were identified as a priority. Those living in residential disability care were identified as a priority under 1A, I believe, and we have expressed a number of times our disappointment in the way that rollout occurred. I am pleased to say that now we have a significantly higher rate of vaccination among people with disability and indeed disability support workers in the ACT compared to the national rate. I think that is in large part because our teams here in ACT Health have worked so very hard with the disability community, with disability service providers and with people with disability to encourage people to get vaccinated and to support that effort, including through things like the Access and Sensory Clinic and in-reach vaccination. So we've worked hard to do that, but there is still more work to do. The vaccination rates are not where I would like them to be. And as we're talking about easing of restrictions today and our pathway forward out of lockdown, the Chief Minister and I have made the point on a number of occasions that we don't just look at our overall community vaccination rate, but we also look at the vaccination rates for sectors of our population that don't have as easy access to mainstream health services or as high a level of trust in mainstream health services. And people with disability are one of those, and we keep a very close eye on the vaccination rates for people with disability as part of our decision making.
I had a question for the Chief Health Officer, but perhaps you might be able to shed some light on it in regard to that cluster at the aged care facility in Bruce, the Calvary Hayden facility. Are you confident we've got a cap on that cluster now, or is it likely we might see more cases as a result?
Look, I think we certainly wouldn't rule out seeing more cases as a result of that particular cluster. There are existing close contacts associated with that cluster who are not currently cases, but we know with the Delta variant that close contacts can very easily become cases depending on what the circumstances of that contact were. So I absolutely wouldn't be surprised if we saw an increase in cases associated with that cluster. I hope that's not the case, but it wouldn't surprise me if that did occur.
In regard with the construction sites, these 2 additional sites being added as exposure locations, quite a large number of contacts as a result of that. Being that these construction sites are outdoors, is there a sort of a risk matrix that this all goes into? What are the risk factors that are looked at when deeming these sites to be close contact sites or casual, for instance?
Yes, so there's quite a lot of work that our contact tracing team does with individual businesses, organisations to have a look at the particular circumstances of a site to determine whether it will be identified as a close contact site, and indeed, even if it's not publicly notified, which individuals within that site might be identified as close contacts. So all of that work is a key part of our contact tracing capacity and operation, and that will have been done for each of the sites that's been identified.
Do authorities err on the side of caution in these cases, even when a location is perhaps outdoors?
Yeah, look, at the moment, absolutely erring on the side of caution, and I think that's one of the things that will be a subject of consideration for the Communicable Diseases Network of Australia that reports to the AHPPC and then into National Cabinet, and for us as health ministers and as emergency cabinets around the country to have a look at what our settings are in relation to contact tracing as we move into a circumstance of having more community transmission, having more cases, and therefore not being able to have our test, trace, isolate and quarantine as effective as it currently is. So that's exactly the work that we need to do. But at the moment, in a lockdown period, our team is taking a very highly precautionary approach when it's undertaking contact tracing.
The Garran Surge Centre, what stage or state of preparation are you in to stand that up if necessary?
So just to clarify again that the Surge Centre was designed to be an additional emergency department capability, so a front door to our public health services and hospitals for people with COVID or suspected COVID. We can stand that centre up very quickly should we need to do so. I think one of the things that we are working through at the moment is improving our forecasting and our modelling to understand what we are likely to see in terms of hospital presentations from new cases, which will give us some advance warning of when we may need to do that. So at the moment, our case numbers are very manageable in terms of hospital presentations, as the Chief Minister's indicated, as we start to open up. And this is a conversation we're going to have with the community in an ongoing way. We will see more cases. That means we will see more presentations to hospital, but our very high vaccination rate should reduce the severity of those presentations and the number of those presentations. And so we'll continue to do iterative modelling and forecasting to understand that, so that if we do need to switch the Garran Surge Centre to that emergency department capacity from its current testing capacity, which is also critical, we'll be able to do that in a timely way.
And I take it the evolving situation at Canberra Hospital is no longer evolving. It's been resolved.
So we do have, I think, I can't remember if Karen talked about this, but we did have one more case associated with that cluster. But in terms of staff, all of those tests have come back negative. So we've had more than 200 tests come back negative, and I'm advised today that now the number of staff that are impacted by having to quarantine for either 5 days as a casual contact or 14 days as a close contact is around 40. So that obviously has an impact, but not a huge impact on operations at Canberra Hospital. And again, I want to thank those staff who've stepped in to work with us on that. Deputy Chief Minister?
Please, yeah, the Education Minister.
Hello.
Minister, given the vaccination status of so many young people in the ACT, and particularly children not being eligible for vaccines at this point, for those parents who are perhaps reluctant or worried about sending their children back, even when we start to reopen, will there still be a provision for online learning? Will there be some sort of requirement as well, perhaps, for teachers to be vaccinated?
Okay. So I'll start with vaccinations in the first place. I think the Chief Minister has said on a number of occasions that we're not requiring mandates in the ACT, that our vaccination rates are really good, and so it's kind of a solution asking for a problem. We don't have a problem at the moment, so we'll continue along with that journey and encourage everybody to get vaccinated for those people who are eligible to be vaccinated. For those students in our younger years, yes, we don't have a vaccine in Australia available yet. However, the health advice from the Chief Health Officer is that we can make the schools as safe as possible, making sure that we have good ventilation, keep up with the physical distancing, ensuring that people are using good hand hygiene. In those year groups as well, don't forget that often those students are in classes, the same class all day. It's a bit different to the older students who move around the school communities a bit more. So it's easier to manage the movement of young people in the primary school years. One of the things that we did hear from the survey that we conducted over the week before the school holidays was that young people, even in primary school from sort of those years 3 to 6 age groups, wanted the option to wear face masks as well. And of course, we'd encourage them to wear face masks if they feel safer doing that. But it's only compulsory for year 7 to year 12 to wear face masks at this time. But if anybody else feels comfortable wearing face masks, then absolutely, please go ahead.
And so, yes, will home learning continue for those parents, those students that are uncomfortable with returning to the classroom for face-to-face learning at this time?
Well, the advice that we have from the Chief Health Officer is that it will be safe to return to school, and that we've been putting in all of the mitigations that we can within our school communities to make sure that it is safe as possible. And so that is our message to parents and school students and to teachers: get vaccinated if you can, if you're eligible. And we'll do everything within our schools that the Chief Health Officer has advised us to do with regards to ventilation and things like, opening doors and windows to make it as safe as possible. But look, there might be circumstances where some students won't be able to attend school, and of course we'll make arrangements for them. But I'd encourage everybody to be reassured that we're doing everything we possibly can to make sure that our schools are safe for everybody.
Thank you, Minister.
Thank you. Thanks, Renee.